So here's the argument that you will sometimes hear. It is that Medicare for all is slavery. Nationalized healthcare is slavery. And you'll hear these from different people like Ben Shapiro, or I believe Ben Carson said it. But I'm here to tell you why it is clearly and obviously not slavery. And I think that Rand Paul tried using this argument with Obamacare, and Bernie Sanders had a physician there, and the physician basically debunked what Rand Paul said. But anyway, so Medicare for all is clearly not slavery. First of all, the Medicare for All plan that Bernie Sanders had was basically just a universal Medicare card. So everybody in the country receives a Medicare card that everybody has. You can then purchase supplemental insurance through the private industry if you wanted to, but everybody gets this insurance card, and then that's then used at the hospitals. So there's clearly nothing about that would make it slavery in any way. But when we start to talk about single-payer healthcare systems, believe it or not, all single-payer means is it's funded by the government through taxes. And because it's single-payer, it's all paid by the government. There are different types of single-payer healthcare systems, and this is where it starts to get a bit confusing. So, for example, in Britain, they have the NHS, the National Health Service. So basically what they do is they actually have a nationalized healthcare where the government pays for it, and it's run by the government. And they actually have a really good healthcare system with wait times that are even less than the United States. Canada, on the other hand, they actually have a system where most of the all of the funding, of course, comes from the government, but most of the Canadian healthcare services are delivered from the private sector. So here's a quote that says, "The Canadian system is for the most part publicly funded, yet most of the services are provided by private enterprises. Most doctors do not receive an annual salary, but receive a fee per visit or service." According to Dr. Albert Schumacher, former president of the Canadian Medical Association, an estimated 75% of Canadian healthcare services are delivered privately, but funded publicly. So they're funded publicly, but they're delivered through the private sector. This is not by any means slavery, because it is just like any other job. Anything else that is provided as a right through the government, even though this wouldn't be providing it as a right, similar to how the Sixth Amendment grants a right to counsel, and that means that you have a right to a lawyer in a criminal case, doesn't mean that the lawyers are then slaves. It's just like any other job. If you want to be a physician or whatever person, and you want to work in healthcare industry, you can decide to work there, and if you do, it's just working like any other job. You can quit if you want to. You don't have to work anymore. No one's going to force you to work. Again, it's just like any other job, and I think that this argument is utterly laughable and just honestly massively stupid.